Hello everyone, it's Ryan Liberty, and in this video I'm going to answer the question, what is obsessive-compulsive personality disorder?
Ooh, ah.
Okay, here we are. We're ready to answer the question, what is obsessive-compulsive personality disorder, but also known as OCPD. But first, I have a few things I need to say before we get to exactly what it is and what it feels like. One of those things is that this is not the diagnostic criteria for obsessive-compulsive personality disorder. This is just a description of it to give you an idea of what it's like. So this is not to be used to diagnose anybody. Only a trained professional should be doing that for you. Second thing I want to say is that if the label of obsessive-compulsive personality disorder, OCPD, bothers you in any way, if it doesn't help you or a loved one that you know that has this to heal, then you don't have to use the label. It's really just to indicate something that may be going on in your life. So if the label bothers you in any way, just let go of it. That's totally okay. A personality disorder is not something that is set in stone. It is something that researchers are always looking into what causes personality disorders, but they are things that can be treated and changed. So if you feel like you or somebody else has this, that doesn't mean it's the end of the world. It just means that there's something going on and that it's something that we can treat. And we also have a stigma, unfortunately, around personality disorders. People that have them are maybe bad or evil. I really hate this, and I wish that people would stop using these words and stop describing people with personality disorders this way, because it's not true. Nobody is bad or evil because they have a personality disorder. However, I do know that a lot of people come to these videos because they are in a situation where they're with somebody who may be abusive or have abusive behaviors towards them, and they're trying to understand what's going on with that person. If that's the case, don't worry about what that person's going through or what their personality is like or whatever. Just take the steps to get yourself safe, distance yourself from that person, take your steps to keep yourself safe, and worry about yourself. Don't worry about that other person, and don't worry about trying to understand them. That's not the priority. The priority is your safety. So with all of that said, I have notes down below. You may have seen me look already, and I'm going to get into what obsessive-compulsive personality disorder, also known as OCPD, is. So it's something that begins in early adulthood, and it has a number of different things that could be going on. So some of these things are that you may be preoccupied with things like organization, rules, order, lists, and schedules, so much so that the reason for doing whatever it is that you're doing in the moment is lost. You get so caught up in the rules and the details and the organization that now you're taking so much time doing that the purpose of what you're doing and the thing you're trying to accomplish no longer matters anymore. It's the rules and the organization that matters. There is a perfectionism that stops activities from being finished. You can't finish the project because the unreasonable standards that you set are not able to be met. So you just keep going back to the drawing board and trying to perfect and perfect and perfect. And because you're spending all the time perfecting, you never actually complete the task. There's excessive devotedness to work at the expense of leisure and friendships. And this is, of course, barring having an economic hardship and actually needing to work to survive. But this is when somebody doesn't have economic hardship and they just work. Like they're obsessed with working. That's the focus of what they want to do, and they ignore spending time with family and friends. They may not budge, and they are tightly conscientious when it comes to things like morality, ethics, or values. And this is not because of their culture or their religious identification. This is just a strict adherence to what they have determined as morals and values in their life. And they will not listen to other opinions. They're very strict on following exactly what they know already. They can't dispose of things that are worn out or worthless, even when they have no sentimental value. It's just that they're hoarders in a sense. They have difficulty getting rid of things just on the principle that they may need them at some point. They won't delegate tasks out unless they are assured that those tasks will be done exactly their way. Remember, they're very meticulous about rules and organization. Money is hoarded and spent very strictly. And just in general, there's a stubbornness. So, and very often something to note about obsessive-compulsive personality disorder is that they do not believe that they need treatment because they see this as a positive thing, that they have all of these rules and ways of doing things, and they think they're right and justified in doing all of this. It's known as ego syntonic. So the good news is there is treatment for obsessive-compulsive personality disorder. If you're able to get somebody with this into treatment, or if you're somebody and you've been able to recognize that it's a problem, there is treatment. You can do things like cognitive behavioral therapy, psychotherapy, or there could be medication involved to help manage any kind of anxieties that you have. So what does it feel like to have obsessive-compulsive personality disorder? Well, first, in your body, as I mentioned, you may have some kind of symptoms of anxiety. So you could be sweating, your heart may be racing, shortness of breath, any of that kind of stuff. And I have a video on anxiety symptoms if you want to check that out. As far as what's going on in your head, cognitively, you may have a lot of thoughts around orderliness and interpersonal control, trying to control other people. So things like, she needs to do as I say, he isn't doing it right. You may criticize yourself whenever you make a mistake or don't follow one of your rules by accident. So I can't believe I screwed that up. You may follow just general rules, things like you never know when you might need something, or you may follow the thought, it's the principle of the thing is why we're doing it. Emotionally, you may find that you're frustrated, you feel like you don't have time for things, you're surprised and yet irritated when people suggest alternate ways of doing something to you, because you know your way is the right way. So when somebody else suggests, you're kind of like, oh, that's strange. But very quickly that surprise turns into irritation because you know your rules are the right rules. Behaviorally, you're going to do things like create rules, lists, procedures, ways of organizing things. You may get worked up about doing things correctly and miss deadlines. You may work a lot, play very little, postpone things like vacation and time off, bring things with you on vacation to continue working on. You may take tasks and hobbies. You may task and organize your hobbies, so they're not really hobbies and leisurely activities anymore. They're just things that have to be done a certain way. You may hoard items that no longer have value. You may hesitate to delegate, and when you do, you are very clear and concise on which instructions need to be done and how the task needs to be followed. And as I mentioned, you may feel that you're stingy with money. So obsessive-compulsive personality disorder, although the person suffering from it does believe it's a good thing, it does produce anxiety, and it is frustrating for them and for other people with them to have to live through. So if you find that you or somebody else is going through this, of course, go see a therapist and they'll be able to come up with a plan to help you through it. But I appreciate you taking the time to learn about obsessive-compulsive personality disorder with me today. If you have any questions or comments about it, or maybe your personal experience, I'd love to hear it, so please leave it below. Hey, it's Ryan Liberty. If you like that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.